Good morning and welcome to Access Health. On today's show, women taking control of their health. It all starts right now.
As healthcare systems work to implement more and more digital technology, patients are also taking a more active role in their health using their own devices. Patients can make appointments, keep track of their prescriptions, and manage all kinds of medical conditions, all from their cell phones. Now, thanks to recent technology, there's also a way to view, share, and manage your medical images. Here to tell us more is Dan Hodgman, CEO of My Medical Images. Good morning.
Good morning, Olga. Thank you.
No, thanks for being here. So first, let's talk about My Medical Images. What exactly is that?
So think about it as the Instagram for medical images. So having access to your medical data is important, right? It's very important to us. We have access to all of our personal photos, but we don't have access to our medical information. And medical images are key because we diagnose off of medical images. And so to have those over a lifetime is invaluable.
So I would have maybe CT scans, MRIs, things that I have had in the past.
Right. Today we don't have access to our medical images.
That's true.
They're kept all around wherever you might have been treated over a lifetime. And they're only kept for 7 years. So that's a problem.
And you lose track of it too.
We lose track of it.
Let's be honest, we're too busy.
So imagine if you had access to all of your medical images, much like you do your personal photos.
This is really, to me, a game changer right now and something that is really necessary. What inspired you to come up with this?
So I was once in the medical imaging business years ago, and I sold that company. And I looked back to see what had changed. And the one thing that hasn't changed is that we still share medical images using CDs. If they could have those images available to them on their cell phone or on their laptop, they would be able to share those images instantly without having to carry around a CD.
Dan, walk me through how this works, because I'm not really the best when it comes to technology.
Yeah. So it's very simple. So you have a CD. We extract all of the images off the CD, and now you have all of the images available to you that you can put into charts for each family member. It cuts down on redundant use of medical images, cuts down on the lost medical images, and it cuts down on the unnecessary images. We're HIPAA compliant. It's a secure way of sharing and managing all of your images. And it's easy. It's easy to use, and then you can discard the CD. So imagine if you could send your medical images to anywhere in the world to specialists who could view them within seconds of you sharing them with them, and you would know when they looked at them and if they looked at them, and you would be able to communicate with them effectively about your treatment options. I have a son who plays baseball. We thought he'd broken his thumb. We took him to a rapid care center. He had x-rays taken. He was told that it wasn't broken, but I wanted to take him to a specialist. So I asked for my images. They gave them to me on a CD. Instead of being able to give the doctor access to those digital images, she printed the images onto 2 pieces of paper. So she provided the doctor with 2 pieces of paper with my son's medical images on them. And I thought, wow.
Crazy.
And so I was able to share with the doctor my son's images on my phone.
Which was more accurate?
Which is much more accurate, and it was detailed. These are diagnostic quality images.
Dan, is it affordable?
It is. It's very affordable. It's $19.95 a year for a family.
$19.95 for the entire family?
That's correct, yes.
For our viewers who'd like more information, where do they go?
Just go to mymedicalimages.com.
Thank you so much.
Thank you, Olga.
Appreciate your time.
Thank you.
Great stuff you're doing. For more information on this fabulous technology discussed here today, visit mymedicalimages.com, or you can always go to our website, accesshealth.tv. See you next time.
While 95% of U.S. adults support organ donation, only 54% have actually signed up as donors, and each day 21 people will die waiting for a transplant. Heather True knew at a young age the importance of organ, eye, and tissue donation. Born healthy and strong, especially in spirit, Heather had a passion for music, was high energy, and full of determination. Everything for her and her family changed when she became ill at 7 years old. Her organ began to fail, but she refused to give up, and her recovery was miraculous. However, her kidneys were severely damaged. Heather lived in renal failure for 5 years, and even though her days were a struggle, she taught those around her about courage and determination. She focused on things she loved, her little sister Taylor, as well as singing, dancing, and performing, but as doctors had predicted, she outgrew her damaged kidney and needed a transplant. It was during those days at the transplant clinic that Heather started to create a plan to help those who were waiting. Heather was lucky and received a gift of life, a kidney from her aunt. This allowed her to continue her mission throughout her teenage years, where she used her singing as a way to connect with crowds, tell her story, and encourage others to register to be an organ, eye, and tissue donor. But it wasn't meant to be. Just before her 20th birthday, Heather passed away. Her parents knew their daughter's wishes and fulfilled her dreams by starting the Heather True Foundation for Organ, Eye, and Tissue Donation.
Here to discuss the importance of organ donation, a truly personal cause for her, is Judy True from the Heather True Foundation. Welcome, Judy. First, I want to thank you so much for coming here to share this message and to spread awareness. Can you tell us what drove you to start the Heather True Foundation?
It was all Heather's ideas. During our many visits to the transplant clinic, Heather met so many people who were waiting right there in the clinic. She started creating a plan to help those who were waiting. So we used her vision to create the foundation.
Hearing your story, I realize how important awareness is. How many people are in need?
The need is enormous. There are over 115,000 people waiting for a transplant.
115,000 people.
And 21 people die every day while waiting. And just one donor can save up to 8 lives.
So for those of us who are watching right now and saying, I want to register to donate, how do we do so?
It's so easy. They just go to the heathertruefoundation.org, sign up. It just takes one moment.
Once a patient finally receives their donation, it has such a tremendous impact on not only the transplant recipient and their loved ones, but the family of the donor as well. The lives of the Millers and Tuckers were dramatically affected by the life-saving decisions of organ donations, and we were able to share the meeting of these two families. Take a look.
My name is Ryan Miller. My story starts when I was a junior at Monroe Township High School. I enjoyed playing sports, especially soccer. A doctor thought I had pneumonia and ordered a chest x-ray.
We had been informed that I had a condition known as non-compactive hypertrophic cardiomyopathy.
Our greatest fear had been realized. I needed a heart transplant to save my life. I found out there are not many hearts available. Luckily, because I was 16, I was put on top of the transplant list. But I had to wait, and the days were filled with depression and doubt. And then we found out we had a match. A heart was available.
Within minutes, what hit Mom and I was the fact that we're sitting here celebrating, and somebody had to lose their life for this to happen. There's a set of parents that lost a child so this could happen.
Dakari, like me, was a soccer player, playing for a club and also Bermuda's national soccer team. Talented, well-liked, and loved by his friends and family. One day at school, Dakari complained of a headache. Within minutes, he was unconscious. He was taken to the hospital, where they found massive bleeding in his brain. After 10 days, doctors pronounced Dakari brain dead. The family decided to donate 5 organs, including his heart, which was a perfect match for me. The surgery was a success, and Dakari's heart was beating strong inside my chest. After a few weeks, I could do everything I could before I was sick. I went on to captain my high school soccer team to a county championship my senior year.
I've been waiting to be able to thank these people. There's no words that are adequate, but just to show them and demonstrate how much we appreciate what they've done, how they not only saved your life, but for all intents and purposes, saved ours.
Meetings between donor and recipient families rarely occur immediately. Both sides need time to heal. It wasn't until we received a letter from the Tuckers a few months ago that we realized we may be given a chance to thank these people face to face.
How are you going to feel when and if they ask to put their hand on your heart?
Embrace it.
Mm-hmm.
And so
I want that, I want them to, if they want to feel Dakari, I want them to be able to feel him.
I want to welcome Chris Hayburn, director of the Heather True Foundation. Welcome, Chris.
Thank you for having me.
Thank you so much for being here. I mean, that video, that message says it all. What a powerful story.
Absolutely amazing, and there's so many stories out there like that. The impact that organ donation has cannot be overstated.
This powerful message has affected so many people, including former NFL player London Fletcher of the Washington Redskins. Can you tell us about his involvement in the Heather True Foundation?
I'm so grateful to London for his huge support of our foundation. When we met several years ago and discussed the mission of our foundation, he generously offered to help us raise awareness by creating some public service announcements, which dramatically increased the number of people on the registry, as it was seen by hundreds of thousands of people.
And here's what London Fletcher had to say in his PSA for the foundation.
Knowing that you have the power to give someone else a chance to live a healthy, productive life is the greatest gift. You don't need them when you're gone, but others do. You have the power to donate life.
What he says is so true. It is the highest form of generosity and compassion to be able to give someone a second chance at life. One donor can save up to 8 lives and improve the lives of up to 75 people with organ, eye, and tissue donation.
There are so many lives to be saved. However, there are still a lot of questions about organ donation. Let's take a look at Dr. Chris Berry, a transplant surgeon and researcher who did a video for the foundation to discuss the facts about organ donation.
Fact number 1. Organ donation saves lives. Previously desperately ill people can realize their full potential in life by receiving the kindest gifts possible, a donor organ. Fact number 2. All doctors and healthcare workers will take care of you regardless of your organ donation status. If you have an accident or suffer a medical emergency, the team of paramedics, nurses, doctors, and everyone else involved is dedicated to saving your life. They don't even think about your organ donation registration status. They are thinking only about you as a living person, and they do everything in their powers to keep you that way. Fact number 3, you aren't necessarily too old or too ill to be a donor. People in their 70s and their 80s have donated life-saving organs and life-improving tissues. There's no age limit to being an organ donor. If you feel in your heart that donation is good, that donation is doing the right thing, then please go ahead and register.
I think that was really important for people to hear. So through the Heather True Foundation, you do a tremendous amount of outreach. Tell us about it.
To involve the youth, we started a division of the Heather True Foundation called True Friends.
True Friends are college chapters and high school clubs that inform, educate, and encourage their peers to register to be organ, eye, and tissue donors. They're student-run, community service-based, and we feel it's so important that the young people get involved. The True Friends members, they set up fun events throughout the school year and even do friendly challenges between the college campuses. We started True Friends 7 years ago, and now we have over 14 chapters in 6 states. Through their efforts, we have signed up nearly 19,000 people and impacted thousands more. So we're so impressed by that, and we know that our long-term effort will be to sign up and register over 100,000 people.
And so they can be impactful and they can make a difference. And Judy, you must be so proud as Heather's mom to have accomplished so much with the Heather True Foundation. It's really a powerful thing.
Thank you. You know, I've been so fortunate because my daughter was so passionate and she got it at such an early age. She was 12 when she started this. So she inspired me throughout her whole life, because she understood the suffering and she understood how difficult it was and what a miracle it was to be able to have her life transformed by getting to have a transplant. She wanted everybody who needed a transplant to be able to have one. Heather's mantra was sign up to be an organ, eye, and tissue donor, and be sure to share your decision with your loved ones. We have the power to donate life.
We have the power to donate life. And for more information to register to be an organ donor, please visit heathertruefoundation.org. And for more inspiring organ donation stories, visit jacksonhealth.org/transplant. Of course, you can always go to our website at accesshealth.tv.
Hey Becca, it's Traci from OPTAVIA. How are you?
Hey Traci, how are you doing?
I'm good, I'm excited. Are you ready to rock or what?
I am. I'm excited and I'm a little bit nervous, but yeah, we're ready to go.
So I really remember, sitting where you're sitting and starting my journey. So I know I was feeling a little bit of anticipation, but I was also just totally ready to rock it. The most important thing that you can remember is this journey is not about the scale. It's about you and getting you healthy and changing what your family looks like for the rest of your life. You're creating your legacy with this one decision that's starting for you tomorrow. Life 82 pounds ago looked a lot different than it does today. I grew up as a size 2, and I found myself as a size 20. That doesn't happen overnight. That happens with a lot of bad decisions and a lot of life happening. I was going to work a lot. I was, I guess, a workaholic, trying to manage my family at home. Very busy schedule. Wouldn't pay a lot of attention to myself, and then I would go with the kids, and maybe I would run through a drive-through, maybe I wouldn't, and then at the end of the day, whatever was in the pantry, take it or leave it, I was eating it. In those 14 years, I carried those extra 100 pounds. I'm trying to figure out how I'm gonna get healthy, how I'm gonna get my life back. So I had tried everything under the sun. You name it, I'd tried it. And then I found OPTAVIA. I had seen a girlfriend, a picture on Facebook of a before and after, looking amazing. And I called her and said, help me, I need my life back. And that's really the way it went. I got a coach, someone who was there for accountability, cheerleading, knowledge, support. I loved that I had a coach, but then there's also this huge community of people on Facebook. It teaches you not only how to lose the weight on the weight loss part of your journey and get healthy, but how to maintain it and keep it off. I needed that. Part of the plan is the food. Comes to my doorstep. I don't have to think about it. I didn't have to pick it. It just came to me and it told me exactly what to do. It was good for me to say, this is the plan, follow the plan, get the results. At the beginning, people were commenting on how I looked or just kind of the difference in how it seemed like I was feeling. The things that my kids were saying were just monumental, I think, in my journey. Anyone could say something to me, but when your kids say something to you, because that's my why. You know, my why is to be there for them. I remember one time going to Disneyland and my daughter Kiana wrapped her arms around me and she looked up at me and she said, Mom, I don't think I've ever been able to wrap my arms around you. And I was like, oh, forget it. The turning point for me was when my mom and my mother-in-law wanted to get healthy. And they said, we'll get healthy when you become a coach. I didn't want to be a coach because I wanted to figure out what my journey looked like. And then I started realizing, how can I say no to changing somebody's life that I love so much? And so I said yes. And it was the absolute best decision I've ever made. The time freedom that I've experienced in being able to become an OPTAVIA coach has been paramount. I still have a busy life. Things are still moving and shaking, but I've literally fit coaching into the nooks and crannies of my life so that I can be a full-time mom, so that I can be a full-time wife. Yes, we still get the kids off to school in the morning, but I don't report to an office anymore. Not only has the community been amazing accountability for me when I started as a client, it's been amazing accountability for me as a coach to make sure that I am continuing to make those healthy choices. Not only does my family depend on it, but all these people that are now in this thriving community, they depend on it. I mean, it has been such a community of beautiful people. We have made lifelong friendships. The journey that I thought was gonna be all about losing really was all about what I've gained. I've gained a new career. I've gained a new lease on life. I have no limitations. There's nothing I can't do. I can fit on rides at theme parks. I can go zip lining. I can go scuba diving. I can run with my kids. I can do anything. All the things that had set me back, this journey has sprung me forward, without a doubt. Truly, the OPTAVIA way is creating space for the life that you want. And I am absolutely living the life that I want.
If you'd like to start your lifelong transformation, find a coach or become a coach yourself, visit optavia.com or stop by our website at accesshealth.tv. See you next time.